Coming up next on Arizona Horizon, we'll look at water levels at SRP reservoirs on the Salt and Verde rivers. There's a new blend of gasoline at the pumps, but some are warning that the new fuel could cause engine problems. And we'll have an overview of the fast-approaching Affordable Care Act. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A strong snowmelt and a healthy monsoon have made for promising conditions at SRP reservoirs that supply much of the water for the Phoenix area. Joining us now is Charlie Esther, SRP's Manager of Water Resource Operations. Good to see you.
Good evening, Ted.
The water levels now at these reservoirs. What are you seeing? What's going on out there?
Well, surprisingly, we are at 55% full, which is exactly where we were a year ago. So even though last year was very dry, we got enough snow melt from the snow that we did receive to actually give us back what we used. So in other words, we get to do it over again.
Everything used, water has been returned.
It has been.
Is that unusual? Was that the forecast?
Well, we were looking, actually no. Going into last fall, we thought we might actually have a wet winter because El Nino was beginning to pick up, and then all of a sudden it just went flat and turned into more of a neutral condition, maybe even very, very weak La Nina, and that's not good for Arizona. So we ended up having a drier winter, but it was just wet enough that it seemed like it was wet because the previous 2 years had been so dry.
I was going to say, you're saying that we got all the water back that we had used, it's all been put back in. Is that the norm? How has that been the last 10, 15, 20 years?
Oh my God, for the last 20 years it's been more dry than wet.
Yeah.
But we've been very fortunate through management of our groundwater and Central Arizona supplies that, we're more than half full. And after 20 years of drought, I'll take that.
Indeed. Real quickly, before we move on, let's get a kind of a basic lesson here. How many reservoirs? Where are they?
We actually have 7 reservoirs. 4 of them are on the Salt River. Roosevelt Dam is by far our largest. And then we have 2 reservoirs on the Verde, Horseshoe and Bartlett. And then we have a new reservoir. It's called C.C. Cragen. Most people will remember that as Blue Ridge Reservoir on the East Clear Creek above Payson. And that was acquired a few years ago through one of the Indian settlements. I
was going to say, I know that particular, I don't want to get too far afield here, but that particular reservoir water supply is a boon to Payson. I mean, their water needs have been met, I think, for like 100 years, at least as far as forecasting is concerned, which is a big deal for municipalities. But is there now a new lake there? Is there a new place to go boating and stuff?
No, it's the same reservoir, it just has a new name, and it's a beautiful location. It's just a wonderful site in the summer.
Oh, it's a beautiful area. Okay. Let's talk about this snowmelt. It sounds like it was a little better than expected, especially since we had the La Nina.
Well, we thought it would be a lot better than normal. We actually, of course, I think every winter is going to be wet. That's just part of your nature. But it ended up being about 80% of normal. And for normal, we usually get about 600,000 acre feet of water. That's about 300,000 gallons per acre foot. So 80% of normal, that's pretty close to normal. So kind of a flip of a coin sort of thing.
I was going to say, considering how dry the winter wound up being in some respects, that seems relatively encouraging. Now, as far as the monsoon is considered, what are you seeing out there?
This is one crazy monsoon we're having. July was incredibly wet. There were locations in Arizona, not always on the Salt and the Verde watershed, that had the wettest July ever. And in fact, Douglas even had the wettest month ever. Wow. And then as soon as the calendar comes to August, it's like it's shut down for a while. It's trying to rain again, and in fact, it looks like the next 4 or 5 days could be fairly productive. In July, because it was so wet, we did actually receive a fair amount of runoff. It was about 20% above normal.
So when we're watching the weather maps and we're trying to figure out whether a storm's coming to our house, you folks are watching the map trying to figure out if water is falling on reservoirs or in areas that run off into the rivers?
Yes, as much as we'd all love to get rain at our own homes every night, it's really better for us if we get rain on the watershed. And in fact, over the reservoirs is probably as best you can get because it falls right into your bucket.
Are there areas of the watershed that are more important than other areas that we could watch out for at home ourselves?
Well, the forested high country is by far the greatest water producer, and of that area that stretches from Williams and Flagstaff all the way to the White Mountains are by far more productive.
So something happening there, good for us.
Yes.
Okay. Let's talk about those who say that water is increasingly scarce in Arizona and in the Southwest, especially now with this prolonged drought. Valid?
I would have a hard time arguing against that.
Because?
Well, we are in a very long extended drought, which is not going to last forever. But when you throw in the specter of climate change and perhaps a warming climate, which is likely to make us drier, or at least cause the effect of the temperatures to cause it to be drier, there will probably be less water than we have been used to.
So what is SRP doing to address those concerns?
Well, this is where I think SRP and all of Arizona entities will shine, because this is a very arid state, and our water infrastructure has been developed to handle extreme conditions. Extremely dry conditions. So I would say of anywhere in the country, Arizona and SRP in particular are probably very well situated to handle climate change variability.
So, and when we talk variability, you're talking, I would imagine, a pretty wide field there, correct?
Well, if you think about our natural climate is so incredibly variable as it is, if you then throw on, 5, 10, 15% more variability from climate change, you probably won't even be able to discern it except through analysis of statistical records. So with our use of the reservoir water, groundwater, the resources that are here in the valley, and the fact that we've recharged over 1 million acre-feet of surface water for use during drought conditions, as well as the CAP supplies that we have, we're very well situated for climate change.
So basically, there's concern out there, but no reason for panic, and you don't see a crisis.
I would certainly not panic, and in terms of a crisis, I guess it's a definition. What's your definition of crisis? I do not believe we're facing a crisis at this time.
All right. It's good to have you here. Thanks for joining us.
Thank you, Ted.
The Environmental Protection Agency recently finalized new standards for renewable fuels that include requiring an increasing amount of renewables, such as ethanol, to be blended into gasoline. One of those blends is called E15, and some say that E15 could hurt your car. Linda Gorman of AAA Arizona joins us now to talk about E15 concerns. Good to see you again.
Thank you for having me, Ted.
Give me a better definition of E15.
Well, right. E15 means that it's 85% gasoline, 15% ethanol. So ethanol is not new to the gasoline supply. In fact, it's been blended into gasoline for many years. Many people are familiar with E10. It is the most popular gasoline blend. But E15 was recently approved for use last summer by the EPA. So it's popping up in all sorts of gas stations.
And the benefits of E15, less dependence, less use of...
It's right. It's part of the Renewable Fuel Standards Program, which actually was passed in 2005 as part of the Energy Policy Act. So it's not a new act, but this required renewable fuels to be increasingly added into our nation's fuel supply. So the intent behind it is very good.
How often increasing here? I mean, we've gone from 10 to 15. When are we going to go to 20? I mean,
well, and that's the thing. The policy calls for increased usage of these types of renewable fuels, but it doesn't dictate necessarily when, and it also doesn't take into consideration the fact that demand for gasoline is relatively flat, nor does it take into consideration the fact that most of the refineries in the United States are set up to blend E10. So it's not a matter of just simply switching over and adding in 5%. It actually is very complicated.
So for E15, only approved for flex fuel vehicles or all vehicles?
No, flex fuel vehicles use an entirely different fuel. That's E85. So that's 85% ethanol, 15% gasoline. Only 5% of the vehicles on the road right now
Yes.
are approved to use E15. So we are talking about a very small number of vehicles. And in addition to that, in a recent survey that AAA did, we found out that 95% of motorists didn't even know what E15 was, and they had no idea if their vehicle could use it.
Well, how do you know if your vehicle can use it? Is there a certain date before this, after that, you can't or shouldn't be using this?
Well, most vehicles can't use it, but the ones that can, it would be in the owner's manual. But the vast majority of vehicles, either they should not use it or their use is questionable. So the problem with E15 is that it has increased alcohol component from the corn-based ethanol, but it can damage vehicle components over time. And we're not talking about small damage. We're talking about significant fuel pump damage, fuel system damage, engine wear and tear that are costly repairs and also may not be covered by your manufacturer's warranty.
I was going to say, I want to get to some of those concerns in a second here, but the bottom line is that some of these warranties may be adios if you wind up doing this, correct?
Right, and again, most people don't know this. So they think they're doing a good thing by putting in E15 if it's available, but what they may not know is at least 5 manufacturers have flat out come out and said that they are not going to honor any, especially fuel-related vehicle claims if a vehicle is under warranty, if that vehicle used E15. An additional 8 have said, they haven't been as blatant in saying that, but they've said they may or may not honor these warranties. So this is a serious concern.
And I'm seeing erroneous check engine lights, deterioration of fuel system, the rubber parts of the fuel
Right.
system, corroding fuel pumps and fuel lines and injectors and stuff, accelerated engine wear. And this is for vehicles that possibly would be okay for E15?
Possibly. So the problem with E15 is we believe that ethanol is a perfectly fine blend for gasoline. So there's nothing wrong with ethanol per se, but more research is needed, more education is needed. I mean, when you put something in the marketplace that 95% of people don't know about and don't know if their vehicles can use it, and then you have manufacturers coming out and saying they may or may not cover these claims, it's very clear that the halt of E15 is necessary at this time.
And I've read something on this that suggests that this could be kind of a move by the oil companies who aren't happy about having to shift over the refineries, who aren't happy about the idea of less dependence and demand on oil. I mean, Brazil sounds like the entire country is on 25 at least percent ethanol. We've already got the flex fuels. Is there really that much concern, A? And B, if there's that much concern and nothing should really use this, why in the world was it approved? Well,
the bottom line is the intent behind the Renewable Fuel Standards program is a good intent. We are too reliant on foreign oil. We're too reliant on gasoline. So the intent to introduce renewable fuels is a laudable one and one that should be continued to be pursued. But what we need is a comprehensive energy strategy. Introducing E15 at a time when the country's not ready, when vehicles may not be able to handle it, and when at the bottom line is motorists may be picking up the additional costly repairs, it's just not the right time. More education, more research is needed.
I think for those of us on the outside looking in, though, would say, okay, it's 10% now. This bumps it up to 15% blend. Really that much difference from 10 to 15% to where AAA is saying don't do it?
There can be, and it's not that we're saying we're against renewable fuels, because we definitely need, as I said, a very comprehensive energy strategy, but we need one that is well thought out, that's well researched, that's well understood by the public, by manufacturers alike. And the other problem with E15 that we haven't mentioned is that these refineries that are making gasoline, the vast majority of them are making E10. And when you have only 5% of the fuel or 5% of the vehicles able to use E15 at this time, you could be creating a tightening in supply of E10. So you could be causing prices to skyrocket, supplies to tighten at a time when it's just not warranted.
I've seen where E15 has been sold and been in use for about 9 months or so.
Right.
Are we seeing a lot of problems? It doesn't seem like there's been all that much reported, at least in the research that I did.
Right. Yeah, it was approved for the use last summer by the EPA. So what we're seeing is a handful of stations are starting starting to pop up and use it. So it's not widespread across the United States. But these manufacturers have come out and said that they will not or may not honor the warranties, which we don't think it's fair to leave consumers holding the bag for costly repairs, at least until we know more about it.
And again, you think further research is needed before AAA can jump on board?
Absolutely. And we applaud the EPA for temporarily halting the sale, which is what they've done for the rest of the year, the sale of E15.
Okay, so they have stopped it now for the rest of the year? For what? For the research?
For to further look into it and see what other options are available, and also to see if the renewable the program is still something that needs to be considered. So we definitely need a comprehensive energy solution, as I mentioned. But when this act was passed back in 2005, the thought was that demand would continue to rise. That hasn't been the case for gasoline. So we still need an approach, but the one that was passed in 2005 may not be realistic.
Interesting stuff. Good to have you here. Thanks for joining us. Enrollment in the Affordable Care Act will start soon for those without health insurance. Now, much has been said and written about the upcoming changes in health care. For an overview, we welcome Dr. Daniel Dirksen from the University of Arizona Center for Rural Health and the U of A's College of Public Health. Thank you so much for being here. We appreciate it.
My pleasure.
And I'm just going to throw all sorts of questions at you because everyone's got, this is one of these things. We've done so many shows on this, and we still haven't covered it enough. When does the Affordable Care Act start?
Enrollment starts October 1st, so just around the corner, and then full coverage begins January 1st of 2014.
And this is for Arizona or for all states?
For all states. Arizona is doing both Medicaid expansion, which not all states are doing,
Yes.
but Arizona is. That starts October 1st, as well as the federally facilitated health insurance marketplace.
Are other states more up and operational in terms of the marketplace, in terms of these changes in general?
I think those states that are doing a federally facilitated health insurance marketplace are all about the same place. Arizona, I think, is ahead of other states as far as Medicaid expansion. I think we're very well prepared and ready for Medicaid expansion come October 1st.
So despite the political controversy and the fussing and fighting down there at the Capitol, other machines were in operation and we are ready to go?
It's really time to put away the partisan politics and move forward with the full operations.
How many insurers will be at play in Arizona?
I think we'll see a variety of insurers. It looks like there's a number of the usual insurers that will be participating and offering qualified health plans on the new marketplace. The insurers that are also vendors for the Medicaid program will continue with the Medicaid expansion. So I think we'll have a very robust participation by the insurers.
And that's a good thing because I would imagine that the more the insurers you have, the lower the prices are going to be.
I think we want a lot of competition and a lot of choices for consumers.
And have we seen reports, and I think I've seen reports that in other states, CBO estimates of the costs, general costs and insurance costs, have actually come in lower than expected? Is that true?
Well, there's mixed reviews. I would say some states, for example, California and New York, they're coming back at 30, sometimes 40% lower for an individual who would purchase one of these qualified health plans on the new marketplace. And then in other states that we're not seeing quite as much, such as Indiana, for example, is looking at it, it might be actually more expensive.
Do we know why some were higher, some are lower?
I think it varies by the degree of competition. If there's a single dominant insurer in the area and there's less competition and less choices, I think we're going to see higher prices. But in states like Arizona, where we have very intense competition between insurers, I think we're going to see the price go down.
Okay, so in Arizona, how many folks will be affected by the Affordable Care Act in general, Medicaid expansion in particular?
So Arizona has a total population of 6.5 million. Of that 6.5 million, 1.2 million are uninsured. We're about 18%. We've been in the bottom 10 states as far as percent of our population that's insured for the last 3 to 5 years. So in the first 2 years after open enrollment, I believe we'll see about 600,000 people who are currently uninsured gain coverage, about half each, 300,000 each, between Medicaid expansion and people who buy subsidized plans on the federal marketplace.
And again, it would stand to reason that the more people that sign up, the better the prices are going to be for everyone.
That's right. This is the challenge, is you want as many people as possible to sign up to distribute that risk and distribute that cost. You can't really do health insurance and cover everyone if people wait until they get sick, until they purchase their insurance. Just like automobile insurance, it's very similar. You can't wait till they have an accident to buy automobile insurance. It's the same thing with health.
It's basically the healthy have to help balance out the not so healthy.
Right. You have to have a broad participation. And I think the other thing is that once you get more people covered, then that cost shifting that occurs is eliminated.
Those who don't have health insurance, are they generally more or less healthy?
Well, many studies have been done that show people who don't have health insurance have much poorer health outcomes. There was a study published in the New England Journal of Medicine, which is a very prestigious journal, that came out last summer that said that early expansion states that expanded Medicaid early, including Arizona, they studied Arizona in this as well, had lower all-cause mortality when people were covered by Medicaid than when they were uninsured. So it's pretty clear, there's many other studies that support that being uninsured is problematic for any health outcome you want to look at.
But with that in mind, again, the idea of the healthy helping balance out the not so healthy, if most of those who aren't insured, not so healthy, what does that do to that equilibrium?
Right. You don't want just the folks that have chronic illnesses and pre-existing conditions to sign up. You want to distribute that and get as many people participating as possible. And there's a variety of reasons for that, but one of the things is you want to get people early on into prevention. I'm a family physician and I'm a strong believer in prevention. You lose that opportunity when people don't have coverage because they can't afford to go in and see their family physician or their nurse practitioner to get preventive care.
Who qualifies? In other words, whose life, whose health insurance life will change with the Affordable Care Act?
Well, the largest change comes in that population that's less than 138% of the federal poverty level. For a family of four, a family income of less than $32,000, if you're uninsured, you would qualify for the Medicaid expansion. Between 138% of the federal poverty limit and 400% of the federal poverty limit, which is a range of $32,000 to $92,000 for a family of four, those are the folks that will get a subsidized premium. It'll be on a sliding scale. You'll get more help the further down the scale you are. And that helps you purchase a plan. And the other part that happens is that for younger people, they may want to choose things where there's high deductibles. They aren't going to get ill, they're the young invincible. So they may choose those plans that are less costly than them overall, but they pay a little bit more out of pocket when they do visit the physician or go to the hospital.
And all of those who will be choosing plans, how do they do it? Do they go to their doctor? Do they go to their computer? Do they go to both?
All of the above. That's one of those multiple choice all of the above questions. But so I think the intent is to have an online ability, just like you would purchase an airline ticket. We used to think, well, that would be very clunky and hard and difficult, and we'd stand in lines at airports. Now we wouldn't think to do that. We purchase everything online. It's going to be clunky and difficult at first for people to choose health insurance plans online, but people will get used to it, and the system will continuously improve because it's competition between the insurers.
Are insurers ready for this? A, and B, once this is implemented, are we going to see a major change in the health insurance landscape?
We are seeing a major change in the health insurance landscape. We've had the lowest rate of increase of health costs over the last 3 years ever recorded in the last 50 years that it's been recorded. Much of that people feel, the experts feel, is related to the recession. but some of it is related to getting more people covered. Some of it is related to people can't be dropped when they get sick. People can't be dropped because they exceed a certain annual limit or a lifetime limit. So we're starting to see a bending of that cost curve where we're controlling cost growth. Costs aren't going to go down. Our population is aging, our population is increasing. Costs won't go down, but if we can bend that curve so that it's closer to the rate of growth of our economy, we'll be fine.
All right. Well, we'll see how exciting times, aren't they?
Yes, very. It's a great, unprecedented opportunity for Arizona to make progress in health outcomes.
It's good to have you here. Thanks for joining us.
My pleasure. Thank you.
And tomorrow on Arizona Horizon, a shortage of Colorado River water is expected by 2016. We'll hear about the impact to Arizona's water supply, and we'll find out about a plan to reduce nighttime temperatures in the valley. That's Tuesday evening, 5:30 and 10, right here on Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.